am Dr. Nolaska Soliotis from Elite Foot and Ankle, and one of the most common conditions we see here at Elite is plantar fasciitis. Plantar fasciitis is pain at the bottom of the heel, and it's usually more painful in the mornings or after you've been sitting down for a long period of time and you stand up, heel is in pain. One of the first line of treatments for plantar fasciitis is stretching and support. This is very important, and so I wanted to do a part one as far as treatments for plantar fasciitis, and I wanted to focus on the stretching part of it, which is a very important component of treatment. So this is Jill. She's one of our amazing assistants here at Elite, and she's helping us to demonstrate one of the exercises that I recommend. So we provide you with a band, and this is a band here. If you don't have a band, you can use a belt. A belt also is very helpful. And you put it on the ball of your foot here. With your knees straight, you're gonna pull towards you. So we want the foot closer to the head. And you're mainly gonna feel it in your hamstrings because we are actually stretching your whole posterior muscle group, meaning hamstring, calf muscle, and plantar fascia. So when you're stretching, you're gonna say, oh, I feel it more in my hamstrings. That's okay, because that we're still stretching the plantar fascia, which the plantar fascia is down here. And you're gonna hold that for 60 seconds. It's gonna feel like it's forever. But the reason why we wanna hold for 60 seconds is because you wanna make sure that the brain actually gets the signal that you're stretching to make it a more long-term stretch. So you do that, and you do 60 seconds, you let go, and then you do it again, 60 seconds. And I usually recommend my patients to do that 3 times in the morning, 3 times at the end of the day. Now, if you bend your knee, now you're no longer stretching all your posterior muscle groups. So you want to make sure you keep your knee straight. So that's one of the ones that are very helpful. Okay, so the next one that I want to demonstrate is a very simple one. And basically what she's going to do is going to just try and touch her toes. So go ahead, Jill, and touch your toes. And for some people, this might be very easy. I think it's pretty easy for Jill. And for some people, it might not. So if you can't reach your toes and you can just reach your ankle, that's fine, as long as you're really stretching that posterior muscle group. If you want to even make it more advanced, what you can do is you can grab your toe, and you can just do it on one, Jill, and then pull towards you like that, and that really gets a good stretch from your glutes all the way down to your Achilles and your plantar fascia. That gets a really good stretch. Remember to hold that at least 45 seconds to 60 seconds. Okay, so one of the other things that I have my patients do with plantar fasciitis is after they're done stretching at night, put a bottle of water in the freezer. Once it's frozen, you're gonna roll it all in the bottom of the heel and the plantar fascia. Now here we have a plantar fasciitis massage ball, which you can also use, but I really do prefer the frozen bottle because it has an ice effect to it, so it helps with inflammation as well. So Jill, what I want you to do is just put it on the bottom of your heel, and you're gonna roll it all along the plantar fascia. And so what you're gonna do is you're gonna sit here at a 90-degree angle with your knee, and then you're gonna roll it all in the bottom of your arch. And I usually have you do that for about 5 to 10 minutes. If you're using a frozen water bottle, I have you wear some socks so then the ice actually doesn't burn your skin. So you do that for about 5 to 10 minutes after you do your stretching. And I usually have you do this for 2 weeks, every day, stretching in the morning, stretching at night, along with the water bottle. And then you follow up and see how you're doing with that. I also add support, and that's a whole other section, and that will be discussed in part 2.